Ashten Black is with us for the next 4 episodes. She's going to be talking with us about our sexual health and development. She's a sexual health educator who's dedicated to helping people of all ages learn about their reproductive health, their really the importance of consent and all the nuances that come with that, and the many facets of relationships. She values fostering curiosity and inclusion. And it's really important for her that we talk about how to reduce shame in this conversation. Okay, Ashten, I'm so glad you consented to showing up again because I thought maybe you'd be a little sick of me by now. We're on to episode 3. We're talking about something a little bit more specific than the last.
Mm-hmm.
Maybe like adding a bit of a lens, a specific colored lens to all the other stuff that we were talking about.
Mm-hmm.
And a lot of people listening either are parenting or supporting or educating kids that are diverse in terms of their abilities. So that could translate to a physical disability. It could be social emotional differences in terms of their neurodevelopment. And wearing those glasses, what does it mean to educate and parent kids through their own sexual development and support kids in their sexual development when it means that they might perceive the world different, experience the world differently? Risks are different. There's more vulnerability in some way. The way we communicate, like I'm just off the top of my head thinking, like for some kids, they are not nuanced. They need to know facts. They need to know, just be straight with me. I can't have the pizza analogy would get lost on them. So if people are listening and go, what are you talking about? Go back to the last episode and listen to the pizza analogy and this will all make sense. But right, for some kids, they're like, what are you talking about? I just need a rule book, because if you have an autistic brain, for instance, this might be much more helpful to communicate in that way of this is what will happen. This is what you can do. This is what doesn't work. This is what, and for other kids, you do not need to walk through that. So today we wanted this conversation to look like helping parents recognize why this might feel extra sticky to have these conversations. And what are some of those examples of, so I think about the basic questions. We're going to talk about the when to start talking with your kids, if they have, like, how to know the difference of when, the what type of information you give. Does that look any different? How do parents host the conversation? And why is it important to talk to kids with developmental disabilities about sex? Right?
Where do you want to start?
Oh, good grief. Well, yeah, anywhere. Okay, let's do the when. Okay.
Yeah.
When, and I know in the bigger picture, we talked about the gradual, but anything come to mind for you that might be different about the when?
Yeah. So very similar to what we had talked about in that first episode. You know, it still does need to be a safe place, but that safe place and the feelings or the awareness around that or what feels safe might be a little bit different. So sometimes in the moment is actually the best time because it's there and it's present and there is less inhibition. So when do you start talking to your kids? You start early. So that's the same as before. We had talked about that. But while we were talking about things being like ongoing, I think it is much more important now that we do it in small, frequent, and repetitive conversations. So that would be my suggestion about when you start, or I guess how would you talk to your kids? I think it's important to talk to your kids so that they receive the right information, but more importantly, how you feel about it. Especially when kids are younger and they're trusting their parents as a source about this, how we model it is going to be really important. I think also, we have said this before, but you really do know your child best. I really want parents to be empowered to know you do know what becomes too much. You know when things are going to be overstimulating. You are the one that is going to know, does it need to be more direct? Does it need to be more tactile? Do I need to use a pop-up book? Do I need to use a
Yeah,
video?
visual
Do I
examples, totally.
How do
Yeah.
they learn? Is it a
Yes.
kinesthetic learner? Is it a visual learner? You really will know what needs, how we're going to teach these things, the different ways in which you are going to teach them. I think the information that you are giving, I guess I'm jumping ahead, but
Mm,
the information that you are giving them is, it's the same as before. But when we say give developmentally appropriate information, that's
mm.
not going to be a cheat sheet of ages one,
Age
1 to
groups. That's
3
right.
or whatever it
Yeah.
is. We do need to, yeah, we really do need to say, while my child is, at a, you know, age 5,
Mhm.
maybe they're not. As you even progress and you get older and you have a teenager, for example, who's going through puberty and who's also experiencing a disability, their body might be going through something that they cognitively are just
Yes.
not there, or
Can't
they were not
process.
aware that this was going
Yeah.
to happen.
Yeah.
So the idea of saying we really do sometimes need to get ahead of these conversations so they know what to expect becomes even
Mhm.
more important. Hmm.
Yeah.
Yeah. Hmm.
Yeah, that's huge.
Yeah.
That's huge.
Yeah.
The type of information, like, so I'm thinking about, like, again, we're going to assess where our kids are at socially, emotionally, what's good, what can compute at any one
Yeah.
given time,
Yeah.
right? And then when we meet them there and we try and have those conversations using the age appropriate language and meeting them in that spot, then is there still any difference about, like, do we stay at the, if someone stays at the cognitive level of grade 2ish to grade 3, are we staying at the level of basic body consent and body parts language? Are we, because their body
You,
will change. So now we're having
yes.
conversation. Oh, this
Yes.
is why this feels
And
so complicated, because it isn't just saying, well, they think like I would say a child who's in grade 2, and then I would just give them the education at grade 2. That's actually, it doesn't serve them, because their 13-year-old body
yes.
that changes still needs information we wouldn't give to a child when they were in
Yes.
grade 2, right?
Yes. Yes. I do think it is like information that's developmentally appropriate as a
Yeah.
guideline, but it's
Yeah.
also experiential. What is my child
Right.
going to experience? What do I
That's right.
know my child will be, especially
Physically
when we're,
experiencing.
yes,
Yeah.
yes, and making sure that that's something that is going to be comfortable for them. And we may not use reproductive, say it is about reproduction, say this is about puberty and we want to talk to someone about
Mhm.
their body changing, and we want to talk about say menstruation, or we want to, the way in which we deliver this information might look
Yep.
very different, but it
Yep.
doesn't mean that they don't deserve to know how it is. And so while I might change my language, and be,
Mm.
how would I put that? To be much more direct, and to use more images, to use more drawings. I'm thinking as I'm speaking to you
Mhm.
about this, Karen, about a really incredible um, sexual health educator who's made cards. Like that's her whole jam is working with people with disabilities, and having worked with them previously,
Mm.
and knowing that our children with disabilities are going to grow through the education system in the same ways that we help them to learn all of those things a little bit differently and more uniquely.
Yep.
We're going to do that with sexual health education, but they do need to have it. Like without a doubt,
Yeah.
not allowing not allowing individuals, even if they're developing differently or at a
Yep.
different pace, to not provide them with the opportunity to have autonomy with their body, um, I think would be quite devastating.
Yeah.
I think about my own experience, and part of why I became a sexual health educator was volunteering and working with people with disabilities. And anyone who's done that knows how amazing and how incredible they are. And while the interaction looks a little bit different, you do know that they want love, and they want
Yeah.
relationships, and they want affection. And while maybe they understand these things differently,
Yep.
and in relation to how we do them, they're still there. So
Yep.
helping them and giving them the guideposts to start to navigate this for themselves
Mm.
on their own unique journey, I think is so important.
Yeah.
Mhm.
Oh, that was well said.
A little impassioned, can you tell?
Well, that's what I love. That's because it's gotta matter to us. That's when we understand what's needed and
Yeah.
where the gaps are. And
Yeah.
we can detect that through relationship when we have lived experience, listening to what people's experiences are
Mhm.
and where the gaps have been for them. And that's for us as well. All the gaps in my own sex education became the thing that I now hunger to know to be able to pass down differently to my kids. And when we are parents, we're always in a state of curiosity of trying to figure out what our kids need at any given time.
Yeah.
Um, and then you add this layer of disability of any kind, we're having to think creatively and outside of the box because any guide or manual you will Google will be for
Mhm.
either neurotypical kids or will be for physically,
Yeah.
developmentally on right on the belt
Able-bodied.
of the curve that is able-bodied, and then we are neglecting people who have the same desire
Needs.
and
Yeah.
needs and don't know how to facilitate that safely. Or and I think about that too from a parent perspective of just what safety looks like for our kids, what teaching safety looks like for our kids who might not be able to discriminate it naturally for themselves. And so, where they hunt for information or discriminate, is this safe information I'm receiving? Can I rely on this source? Their judgment for being able to recognize when
Absolutely.
something's at risk for them uh,
Absolutely.
is not the same, you know. And so, our parenting responsibility feels so much more heavy and complex because we're having to decide that for our kids without trusting that that may naturally be kind of occurring for them, that they can draw on that for themselves. And if we don't have that, we're looking at
Mhm.
20, 24, 28-year old children and worrying about them
Yeah.
because we don't know that they're being taken advantage of, if they are being taken
Yeah.
advantage of, and if they can tell the difference, right?
Yes. Absolutely. And I
Tricky.
think
Yeah.
it's so tricky. And I think the really unfortunate truth is that people with differing abilities are more likely to
Yeah.
experience adverse sexual encounters,
Yeah.
for a
Yeah.
multitude of reasons. And so
Yeah.
there is that like experiential part of it where they are perhaps taken advantage of, or they don't understand a power dynamic, or they, exactly those points that you were making that put them into unsafe positions. The other thing too is that there's this fine line, and I really have a lot of love for parents, and I who are going through this, because you for so long are the advocate. I mean, all parents are
Mhm.
advocates for their child,
Mhm.
but you are an advocate in a very different way when you are
Yep.
also trying to help them navigate the world that feels different. And at what point do you start to relax the autonomy in knowing that these individuals are going to grow into adults? They are going to grow into adults who
Yep.
have physical responses, who have hormones,
That's right.
who are going to have
Yeah.
reproductive systems regardless of their cognitive ability.
Yep.
Um, or the same thing to be true with people who have physical disabilities, is they too are going to want a relationship. Just because you don't navigate the world in a typical way does not exclude you from puberty. It does not exclude
That's
you
right.
from wanting love and affirmation and
Yeah.
presence. It's so
Yeah.
important. So I do really feel for those parents, because there does come a time where we have to hope,
Mhm.
that they're going to be able to discern that. Now, even with that saying, is that there's a huge spectrum of that as well. So what autism looks like for one family is going to look incredibly
That's
different
right.
for another. What
Totally. Yeah.
Down syndrome looks like for one family can be incredibly different for another.
Mhm.
And just in our own effort, I think we just try not to limit, like, let's try to
Mhm.
be open to the experiences that they could have, because I think oftentimes we assume
Mhm.
through our ableism, through our own lenses, that somehow, because there is a difference, the value is also different, or the value is less, and it's just simply not true.
Absolutely.
It's
Yep,
just
that's
simply
right.
not true.
Right.
To make it a little lighter, because I feel like I was so heavy.
Yeah.
It makes me think of the documentary right now on Netflix about love and about autism, and how whenever I watch that, it makes me smile. There's something that's so, if people are ever curious about why it would be important to talk to your children with different abilities, that is the show to watch, because
Yeah.
it is so human. It just identifies how human we all are, and how important inclusion could be to helping them live their fullest. And
Yeah.
that is in sexuality too. That
Yeah.
allowing them to live their sexuality in a way that is safe, in a way that is, again, pleasurable, and in a way that's appropriate for them, I think would be so important.
When I was watching Love on the Spectrum, I
Yeah.
only watched the first few episodes so far, but what stood out to me was the parent role in
Yeah.
supporting adult kids in their up to 30s, right?
Yeah.
And walking them through the dating process, and just the space they held for, I think they deserve to experience this. I'm excited for this. This is a new step. This is a new stage. And these might be the types of things that we're fostering, maybe in different ways, but earlier, for our more developmentally able people.
Yeah.
That becomes the conversation is just so it's so amazing to watch that unfold between two adults, not between an
Hmm.
adult and a child, right? Or an
Hmm.
adult and a teen, about the
Hmm.
first kiss or the
Hmm.
first whatever. And the wishes that they are granting them. Like, I wish for you this, and I want this for you, and I'm excited to hear back. And what was that like for you? Well, what do you want in a partner? And have you thought about this? And then they pull out their lists, right?
Yeah.
And I'm just like, just the role of support person in the background of, oh, you like that about, and we should get a coach in to talk to you about practicing a first date. And I'm like, I could have used that. I could have
Yeah.
used somebody saying, let's go on a practice date. And I'm going to tell you what comes across well. What does it come across like? Right. But
Yeah.
it's
Yeah.
so lovely to watch that unfold, for all the things that we are left usually to just go out there and figure it out.
Yeah.
Right.
And
And yeah,
sorry to interrupt you, Karen, because I
no,
think
go.
I want to touch on that, because I think what they did was they did it so well. They do all the
Yeah.
things that we've been talking about in the previous episodes, but they do it so uh, directly, like it's
Yeah.
so, because it needs to be. And
Yeah.
the one thing, like taking a moment just to really, I'm giving a virtual hug to our parents who are parenting children with differing abilities, because I think sometimes they actually do a better job. And I don't
Mm,
mean that to shame anybody, but I mean it in the sense that they're much more attentive to doing it
they've had
because
to
they
be.
know the
Yeah,
implications
that's
if
right.
they're not able to. Um,
Exactly.
because they simply just can't avoid doing it. And they have had to have difficult conversations for everything else as well. So they're
That's right.
just a little bit more practiced. So sometimes I do want to like extend those hugs out, because it's so well done that they were consenting, and that when we think about that TV show, they were consenting the whole time, and how well that was playing out, and how well they were learning to express themselves. And
Yeah.
yeah,
Yeah.
it really warms my heart. Yeah.
I love the encouraging when they're truly ready to encourage someone out of any nest, right? Like when they can fly, to have
Hmm.
someone go, I want you, I'm cheering you on,
Hmm.
is so powerful. And that, I think, is for all of us in our own sexual exploration, our own development, our own questions, our own curiosities, when we know that the person doesn't have all the answers, but they want us genuinely to experience something good that's
Hmm.
important to us, that is a part of who we are, and they are willing to be cheerleaders for us in
Hmm.
that, is like
Hmm.
that just that to me is kind of like the backdrop role we can play for our kids, no matter where they're at and
Exactly.
what different abilities they hold. The frame is, if it's something that I know matters, could matter to you, maybe you don't yet know will matter to you, that I want to host encouragement and excitement for you about what could
Mhm.
happen, right? Like that.
Mhm.
Yeah.
Oh, it's so
Yeah.
amazing. Like, if I had to tie a little bow on it for all parents, it's just the
Yeah.
ability to be present and the ability to be affirming. The
Yeah.
those 2 things, if you can do those 2 things for your kids of any ability, it's gonna make the experience of exploring human sexuality all that more pleasurable, all that more safe.
Yeah.
Because we do know that the reality, the harsh reality, is that it's not always safe for people with
That's right.
developmental disabilities. It just simply isn't. When we take kids out of typical sexual health education, if we think that our children now are not getting comprehensive sexual health education, and we then think about how our children who need extra support in learning are now
Yeah.
not learning that,
Yep.
it becomes fraught. It just becomes fraught with scary statistics of who gets taken advantage of. It becomes scary for me, Karen, and where this became a particular interest was when I was learning about life expectancy. When I was learning that some of my friends and the people that I was volunteering with have lower life expectancy, not for any other reason
Yeah.
other than people are not experienced in working with them, whether that is dental, whether that is optometry, whether that is at a GP. And as an adult, as they do learn to live somewhat
Yep.
independently, that they're still seen as an autonomous person. If
Yep.
I go to a doctor's appointment and I'm struggling to ask about my medical health, my pap smears, my breast exams, my STI
Yeah.
testing, what would make, if my doctor doesn't bring that up with me,
Yeah.
what makes me believe that the
Yep.
current system would then ask them? Because their concept of where those people are and what they need to be concerned about
All the assumptions. Yep.
is somewhere else.
Yeah.
And that's what really stuck with me was how do we help them to be their own advocate so that they're not experiencing those inequities on a greater level, just from
Yeah.
that standpoint, just from that
Yeah.
alone, is
Yeah.
how do we talk to those people? If you are 45 years old and living with Down syndrome, and while you're living independently or supported, are you able to go to a doctor and know that you should be asking for a breast exam? Who's going to have that conversation
That's
with
right.
you? Who's going to ask about
Right.
a prostate exam? Are these life expectancies as a result simply of a lack of health literacy, and a lack of health literacy that we can do so much better for these people if it was met on their level, because we accept inclusion, we just accept that there are different abilities.
Yeah.
Yeah.
That's huge. That is
Yeah.
huge. And that so much is the reason why parents can't pass a baton to systems of
No.
care for adults,
Hmm.
because it isn't being picked up.
Hmm.
So we still have to attend, right?
Hmm.
We still have to come with, we have to
Hmm.
advocate for.
Hmm.
And not everybody has the language or just the confidence to be able to say, I have the right to ask that question in the doctor's
Oh.
office. So
Oh.
the
Yeah.
hand holding that's required, right? That you said, it's just exponential
Oh, and if
for
we
our
have,
more vulnerable population. Yeah.
yeah, and if we honestly are more, there are other considerations that are more pressing in that moment
Mhm.
than reflecting on, is this something that we should also be talking about?
Yeah.
When there are
Gets
other health,
shelved.
yeah, yeah,
Totally.
and
Yep.
that's so fair. It is so fair. Um, and it is difficult. Like, I do want to acknowledge that it's so challenging, but um, for those people, for those folks with disabilities, I just really, for myself, want them to grow into adults that are seen and accepted and, actualized in their full potential. And part of that is going to be their human sexuality. It might
Yeah.
look different. We might have to
Right.
adjust our expectations of relationships, but we all have strengths and we all
Yep.
have weaknesses. And for some of these individuals, they might need a little bit more extra help, but there's absolutely no shame in that.
Mhm.
No shame. I would love for us to be able to get to a point where we're doing this in such a way that every single person is entitled to having a positive, sexual, healthy experience from
Yeah.
relationship through to themselves, and to know that they do have autonomy for themselves.
Mm.
Yeah.
Yeah. The development and the movement in our development on any one frame, I just think of when we talk about kids with differing abilities, we often think about timeline being different, like it's
Mhm.
delayed or it's advanced, or it's like we have those kind of qualifiers, right? Which is its own limiting way of explaining it. But
Mhm.
that some of those things might emerge, and then we feel like it's too late to bring it up. Like I think about caring
Mhm.
for, like, how are we supporting our adults with disabilities whose parents never thought to have that conversation or thought it would be
Mhm.
important to have that conversation. So it's almost starting from scratch, right?
Mhm.
About understanding their bodies from that
Mhm.
lens. And and how do we begin to insert that into the conversation when they're 30, 40, 50-year-old people
Yeah.
who are now recognizing for the first time or don't even know to recognize? Has anybody taught them what touching certain parts of them is going to feel like? Like,
Yeah.
has that, and do we, I just think it's so, it becomes such a scary thing that we just reserve it. We go to, it hasn't come up, so I just won't say it.
Yeah.
So how
Yeah.
much more deliberate do we have to be, right? Because I think about raising our more neurotypical kids or our developmentally if it's in on track with what we expected, I think we feel more prepared. And
Mhm.
so when it comes up naturally for our kids, then we all are almost educating them reactively. Okay, you're raising that, so I know you're ready to hear more. If that's not happening for people with disabilities, is it part of our advocacy and responsibility to actually intentionally teach them that
Mhm.
this is part of how
Oh,
your body
yeah.
functions? And right? And then
Oh, yeah.
right. Which feels very
Absolutely.
different approach, right? So if we're not changing the way we think about having those conversations, then I think our natural default is, well, I'm still waiting for it to come up, and then they haven't
Yeah.
brought it up, so then it's not important, right?
Yeah, and we did talk in an earlier episode about how, like, hopefully your child is going to at some point in time express curiosity and maybe come to you. And then we talked about how we
Mhm.
might get a clarifying question, you know, neurotypical or diverse abilities or not, they may not come to you. So there is a specific reality in that
Mhm.
those with differing abilities, it may not cross. It just may not be part of something that they're going to come to you with. So I think
Yeah.
knowing, and for parents just in general, if your kids aren't talking about it, it doesn't mean they're not thinking about it.
Yeah.
And talking about it doesn't mean that you're going to encourage something that you don't think that they're ready for. It is
That's
simply
big.
yeah,
Yeah.
it is preparing them with information. We know all ability levels that comprehensive sexual health education, the more information that children have, the more prepared and the more knowledgeable that they feel, and the more they know that they are supported, the more likely they are to delay
Yeah.
what we would call a sexual debut. They're more
Right.
likely to get tested, or they're more likely to speak to their doctor, or they're more likely, if they're having relational challenges, to speak to someone that they trust. So when we bring that back to our children with different abilities, it's the same thing, but we
Mhm.
may need to be more conscientious about prompting that conversation of, yeah, I'm trying to think of a really good example, but perhaps they're both on a team, and they're playing soccer together, and you have one of those individuals express a real specific interest in someone else, and being really attentive to, oh, how does that make you feel?
Yeah.
Starting with those basic kind of questions of, okay, so we're probably going to need to talk about maybe boundaries. Maybe we need to talk about consent
Yeah.
of touching, consent of, do they want to be hugged because you love to hug everybody?
Mhm.
Like,
That's
that's a
right.
very specific reality
It's a great
of,
example. Yeah.
and okay, so you really like to hug everybody. Not everybody's going to feel that same way. What are the ways in which we can ask someone about that? If
Yeah.
someone is hugging you, do you always like it when they're hugging you? And
Yeah.
if they didn't, do you know who you would go talk to? So you might have to
Mhm.
lead it a little bit, but you still want to provide them with the chance to have, and some autonomy and open-ended curiosity about how they're feeling
Yeah.
for that purpose. But we
Yeah.
might have to be a little bit more intentional. If it's not coming up, it doesn't mean it's not happening.
It
Or they're
doesn't.
not thinking about
I
puberty
know.
will still come for you. If
That's
there's a
right.
few things I
Yeah,
can guarantee in life, is
that's
one of
right.
them is puberty will probably come for you.
For you. It comes
Yeah.
for you. And I imagine like how confusing it feels when your body changes and you don't know what to make of it. But if you have language skills and safe friends and ways of communities that foster those kinds of discussions, there's places to say the things you don't know. And that's where it grows. If
Hmm.
you are not finding yourselves in that zone with other people to be able to say that, or you don't have the language skills to express, "Ooh, that happened." How are
Hmm.
you where's the lead in for other people? That I think is so much why we end up assuming it's not happening
Yeah.
if we're
Yeah.
not hearing about it.
Yeah.
And we need to be brave and assume it's happening. It's okay to
Hmm.
ask. It's okay to check
Hmm.
in. It's okay to suggest that this might become a thing.
Hmm. Yeah. And
Yeah.
same, but different. So I always love this analogy. Like,
Mm.
we both have a nose, but it looks different. We both have, so same.
Yeah.
We're all going to have very similar experiences. We're all going to experience puberty, or we're all going to experience a sexual debut, but they're going to look different.
Yeah.
And we just need to prepare ourselves, and to be ready and receptive
Yeah.
to having those kinds of conversations, because they may appear a little different. I don't think that's new to our families, though. I think that they
That's
know,
right.
if you have children with
Yeah.
differing abilities, I
Yeah.
think we do have a very clear knowledge and understanding
Yeah.
that that's just part of the journey.
Yeah.
Yeah.
Any last minute thoughts on this topic that you're like dying to pour out? We need to hear about.
Oh,
I'll let you think about that for a second, but
yeah.
it's a big topic.
It's a big topic. I think if I had to leave it just with anything, is that parents are doing a great job. You're doing the
Mhm.
best that you can. You know, I have so much time and empathy for people who are finding new ways to talk about these things.
Yeah.
But for anyone who's listening who maybe doesn't have, a child with a differing ability, is maybe providing that also as a lens. So please know
Mm.
just the importance of inclusivity, the inclusivity of for identity. This is just one small part. It's one small part to have autism. It's one small part to have ADHD. It's one small part to be Down syndrome. It's one small part that goes along with a much bigger part of who we are as a person. And to be seen, we all deserve to be seen
Yeah.
in our full selves. And so
Yeah. Yeah.
that's why I'm so
Yeah.
passionate about it.
Yeah.
Mhm.
Amazing.
Mhm.
Okay, we will wrap this one up and I'll see you back here for the last episode in the series.
Oof, thank you. Thank you so much.